Fusion Mobile, quality e-learning experience on the go.
Towards better health. Pathogenic or harmful microorganisms have the ability to wipe out the whole of humanity directly or indirectly. They therefore must be controlled through some measures in order to stay healthy. In the control of harmful microorganisms, the use of drugs like antibodies perform key role in checking the spread of microorganisms. Dehydration tends to inactivate the microorganisms since most of them require water for metabolism. The use of high salinity or salt, especially in preservation of food, helps to control harmful microorganisms. Application of high temperature destroys pathogens. This is used in sterilization of materials, for example, in the hospital. Antiseptic application involves the use of low concentration of chemicals like phenol or carbonic acid. They prevent or inhibit the growth of microorganisms. At times, they kill them. Disinfectants are high concentration of phenol. They kill microorganisms outrightly. The use of low temperature or freezing also kills or inactivates some microorganisms. The use of irradiation controls the growth of microorganisms. Immunization, which includes vaccination or inoculation of anti-disease sera, protects the individual from contracting the disease. This is because antibodies or antitoxins are produced by the body. Quarantine services. Quarantine services or isolation of infected persons or animals should be done. This is to observe such persons or animals for evidence of a disease before they mix with the general population. Personal hygiene such as washing of hands before and after meals should be observed, and food should be covered always to prevent contact with vectors of disease-causing microorganisms. Vectors are organisms which convey a parasite from one host to another without itself having any sign of danger or harm. For example, we have the mosquito, the sassafly, the ticks, and black fly. On the screen are lists of some vectors with their organisms responsible for the disease they carry about. The housefly, the organism responsible is the Vibrio cholera, while the disease is cholera. Female Anopheles mosquito, the organism responsible is the Plasmodium parasite, and the disease imputed is malaria. Sassafly, the organism responsible is the Trypanosome, while sleeping sickness is the disease carried about. Aedes mosquito, the organism responsible is known as virus, and yellow fever is the disease incurred. Black fly, the organism responsible is the roundworm, and river blindness, also known as the onchocerciasis, is the disease imputed by the black fly. The water snail, the organism responsible is the flatworm, and the disease imputed is the bilharziasis or the schistosomiasis. Ways of controlling vectors. In controlling the spread of housefly, adults are killed using insecticide. We are to also prevent breeding grounds. We should cover our foods from flies. We should keep our environment clean. The surrounding of pit toilet must be covered and kept clean. And also, the continuous spraying of insecticide even after the initial spray has been done helps to control the spread of housefly. In controlling mosquitoes, we are to destroy the breeding grounds. We should make use of insecticides to kill them. We should destroy or bury empty cans and bottles. We should make use of biological control such as introducing tadpoles, bacillobacteria, which are known to feed on the mosquito larvae. We should also make provision for nets in our doors and windows. The black fly. The vectors are very difficult to fight, so the only way possible is the destruction of the breeding site. Other methods include the use of drugs such as suramine and the diethyl carbamazine with serious side effects. Water snails. In killing water snails, the use of the insecticides for killing them, which is known as the molluscicides, should be employed, as this affects the breeding of infective larvae. Good hygiene and sanitation in order to maintain clean environment should be practiced. Outright treatment of infected people to stop the spread should be done. Water snails can also be controlled by disrupting the food chain by killing some water weeds eaten by the snails. Public Health Authority. Public Health Authority executes health schemes. This they are able to achieve by working hand in hand with Ministry of Information in order to disseminate information to the public and at the same time educate them. The functions of Public Health Authority includes 1. Provision of clean water. Here, tap water is made available for the communities or alternatively boreholes are sunk in rural areas. The water is chlorinated in order to avoid spread of waterborne infection. They also help to provide incinerators which help to treat refuse and so convert them into agricultural use, especially in urban areas. They also help in refuse disposal. Refuse and sewage are discharged are treated promptly. This helps in controlling the spread of diseases. In rural areas, pit latrines are dug, while in urban areas, toilets are used. They help to protect food, in that industrially manufactured food are canned and are deemed fit for consumption by the standard organization before it can be consumed. They help in control of diseases. People with infectious diseases are kept in special hospitals to avoid the spread. They administer vaccinations or inoculations against smallpox, poliomyelitis, measles, and yellow fever. Sanitary inspectors who go from house to house make sure that they are in good sanitary conditions. Houses are approved by the authority before they are built, and efforts are made to see that builders comply with their plans. Sanitary laborers are sent to clean streets, clear drains, and tidy up public places like marketplaces. The public is also educated on the side effect of contagious diseases through the mass media. Ways of maintaining good health in a community. Effective public health administration in a community can be achieved through 1. Refuse disposal, sewage disposal, protection of water, protection of food, and the control of diseases. Refuse are solid waste materials discharged through human activities from homes and industries into the environment. Reckless refuse dump around dwelling places creates bad odor. Refuse disposal can be done through the provision of dustbins in strategic locations, burning refuse in incinerators, dumping them in isolated areas far from human habitation, and burying refuse in a sanitary landfill. In sewage disposal, sewage are wastewater materials discharged from laundries, kitchens, toilets, bathrooms, etc. For example, urine and feces. Sewage disposal can be done through the use of pit toilets where feces and urine are passed into deep pits. Also, through the use of septic tanks where water is used to flush feces and urine into a big tank dug in the ground. And also through community treatment process where sewage from various homes are collected and treated before being discharged into oceans or rivers. In the protection of water, unclean water should be protected in the following ways: through the addition of alum to water, boiling of water before drinking, filtration of water on cooling, addition of chlorine to kill microscopic germs, and the storage of water in clean containers. In the protection of food, the diseases that can be contacted through food must be protected in the following ways, which include 1. Keep food in refrigerators or deep freezers. Boil or cook raw food properly before eating. Avoid exposure of food to flies and other microorganisms, and you have to wash your hand before and after eating food. In the control of diseases, the diseases can be prevented through the following ways, which are 1. Through the daily sweeping of the surroundings, eating of balanced diet, taking of baths regularly, wearing clean and neat dresses, living in well-ventilated houses, cleaning your teeth regularly with toothbrush and paste, doing exercises regularly, and taking no drugs except those prescribed by doctors. National health bodies. National health bodies include the Ministry of Health and Public Health Authority, while international health bodies include the World Health Organization, United Nations Children Emergency Fund, Food and Agricultural Organization, and the Red Cross. Functions of the World Health Organization. The World Health Organization assists member nations during emergencies. They assist in training medical and paramedical staff. They help to standardize drugs. They supply drugs to member countries in need. They inform member nations of any epidemic. They help in immunizations. They promote good health. They provide food to refugees, and they grant research for health. Functions of Red Cross. Red Cross helps to train people on how to aid wounded people. They maintain truce or agreement to stop fighting. They also fortify students against emergencies, and they help to rehabilitate victims of catastrophes. Functions of the UNICEF, now known as the United Nations Children's Fund. They provide various equipment, medicines, and vaccination services. They provide children with milk and proteinous foods. They help in training midwives. They help in feeding destitute children, and they help to set up material and child welfare centers. Functions of the Food and Agriculture Organization, also known as the FAO. They give advices on branches of agriculture. They give out free samples of plant species with high yield. They also campaign on the effect of good feeding to good health.